Thank you very much. My name is Abner Mason, and I'm founder and CEO for ConsejoSano, which means healthy advice in Spanish. ConsejoSano is a patient engagement or member engagement and member navigation solution. We work with managed Medicaid plans and also provider groups. What we focus on typically is helping our clients to increase HEDIS measures, close gaps in care, increase satisfaction, and reduce unnecessary ER visits. Those are some of the things that we focus on. We at ConsejoSano, move to the next slide. We serve everybody. Every Medicaid member is important, and we serve them all. But we have developed special expertise in working with multicultural members. And by multicultural, I mean members for whom culture and language is a barrier. It makes it difficult for them to access care. So we've developed a deep expertise there in focusing on those multicultural members and helping them to overcome the barriers that prevent them from accessing care. And the reason this is so important and why we focus on it is that our country has changed. We're not the country we were 30 years ago. According to the U.S. Census, we're on the way to becoming a majority-minority country. It'll happen in 2050. California, where we're headquartered, although we are in 9 states, we serve 9 states now and we're growing. We want to come to Arizona, not here yet. We're in 9 states. California is already a majority-minority state. It's 40% Hispanic. So is Texas. Arizona is 37% Hispanic. Almost just under 50% of the kids in K through 12 in Arizona are Hispanic. So if you add the other minority groups, you can see that there is a huge challenge here because this demographic change I've described, it's huge. It's really big change. And certainly not everyone in America is prepared to accept it, as you can see from our national politics and other areas. But healthcare hasn't kept up either. The truth is, our healthcare system is not equipped to serve the America of today. And I think, and I know you share this view, we've got to do something about that. And that's what ConsejoSano is focused on, is trying to bridge that gap. And how do we do that? We do it by trying to build trust. Because if you're going to engage people, particularly multicultural populations who already are struggling, they have trust issues, they have understanding in terms of language and culture issues, you got to build trust. And how do you build trust? We believe at ConsejoSano, we started with this belief and we're proving it now. We've got data. If you start with culture, if you connect with people as who they are, what they believe, what they fear, where they come from, where they live, their basic values, if you can connect at that level, you can build the kind of trust that allows you to engage. And that's what we've done at ConsejoSano. We built a technology platform that allows us to ingest an enormous amount of information, both public data and private data. We add to that the expertise of a really diverse team, which you'll hear a little bit more about, who have deep expertise in culture at the zip code level and at the community level. We run that through our technology platform, and that allows us, when we get a new client, to take a large member population and to segment them into cultural cohorts, what we call cultural cohorts. And then we create content for that cohort. So just to make this clear, we start with culture. We run it through our platform. It's a machine learning platform. It helps every time we interact with someone, it gets smarter, sort of like Here Angel. So first we start with culture. Then we design content based on the culture. Then we add the language. And fourth, we communicate that message through mobile, through the preferred method of Medicaid populations. And what we found in our experience is no question it's mobile. And not just mobile, it's native mobile, text messaging. So what we do at ConsejoSano, again, I just want to emphasize it. First, culture. Second, content. Third, language. And fourth, the preferred mode of communication with the member. That's how we're getting the kind of results that we're getting at ConsejoSano. And you'll hear a little more about that in just a minute from my colleague. In addition to the country changing, members are also changing. And this is why I want to sort of double down on the conversation about the mode of communication. Today, increasingly, people are on mobile. If I asked you how you communicate with your friends and family, if I asked you to raise your hands, how many of you use text messaging? I'm sure most of you would raise your hand. I've done this so many times, I don't have to do it anymore. But if I asked the plans here, how many of you are using text messaging to communicate with your members, to do population chronic disease management, population health management, to connect? I'm I'm unfortunately, I have this experience all the time. Most plans are not. And I understand that. There are some challenges that we have to overcome to get there. But I want to encourage you, if you take anything away from this, our presentation, we've got to meet people where they are. We can't ask them to change. We've got to change. And they want to communicate via text messaging. And so we have to find a way to do that. At ConsejoSano, we know that there's lots of data on text messaging. I'm not even going to go through it because I know you know that this is the way that people communicate. But I just want to make it clear that it is the preferred method. It's very effective, and it's also not expensive. People are very comfortable with it. Let me just say something about our products. We have a range of products, and I think the two-way SMS messaging is the way that we engage most of our clients. We get incredible results. You've got some in front of you. One of our clients, Blue Shield of California, did a press release on our results with them. I'd encourage you to read it because it shows from the client's perspective how we are using text messaging in 22 different cultures and languages to communicate with their members. And here's the point I want to make to the plans here. I know some of you are struggling around this text messaging issue. So we work with plans. We can start with live outbound calls. Just like we meet members where they are, we'll meet you where you are. Wherever you are in the process, I know where you want to get to, and we can help you get there. Just talk to us. We're helping plans across the country to move into 2019. It's no longer, this is 2019, and we've got to, as healthcare, meet people where they are. So we've got a range of products. I won't go through them all, and you'll get these packets. But we are excited about what we're doing. We built a platform that allows us to do something really kind of cool, which is to balance tech and touch. So we built the platform. It allows us to create these cohorts. We can do it quickly. We can do it at scale. We can create the messaging. We can send it out. Everything is two-way, so we're learning. Every time we have an interaction, we're learning. But we have an incredible team that looks like the United Nations in terms of its diversity, that brings expertise so that we always have that human touch as well. So I'm going to turn it over to my colleague, Kim Howell, to finish the presentation.
Yeah, thank you, Abner. So all of this sounds great, but I'm the operations person, so I'll tell you how it works. We all know that's the real challenge. So when we say that we balance tech and touch, what we really mean is that, like Abner mentioned, we have to meet members where they are. So we have to know where they are. We start out with community detailing, which sort of dives into the population analysis, zip code level data. Then we move into resource analysis. So we also look at what's available in the area. We look at life expectancy. We look at transportation issues. That's a huge one. And then we also look at the density of grocery stores, pharmacies, what they have access to in the community so that we can build on that. From there, we layer in our cultural acumen. And so what I mean by that is we have focus groups, we have our own algorithms, we have machine learning, but we also have a lot of people that we work with who help us dive into a population and really understand what drives behavior change. So for example, one of the notable metrics that we have here is, for a Lebanese population, it's actually pretty interesting to note that there are only 96 family medicine physicians in Lebanon. So if we're doing a campaign with more than 5% Lebanese population, we may need to explain to them first what primary care is before we can encourage them to make an appointment. So there's a lot of steps that we take in our member journey. It may not just be one message that we craft, but it could be a whole myriad of messages, diving a little bit deeper into what's available in the area, what challenges may need to be overcome first, and then so that's exactly what Abner was saying, right? We meet them where we are, where they are. We help them understand what needs to be done, and then we take baby steps to help them get there. So once we've got that basic understanding of a population, we put it sort of into what we call our member insights platform. So this is where all the machine learning and AI comes in. We take not just the data that we have, but we also take the rosters, encounter data, any environmental data, which is pretty important in LA with all the wildfires, things like that happen. We also pair that with SMS responses that we've had and trends that we've found within our own engagement. We look at social media, and then we sort of create some algorithms that generate these messages and campaigns for members. The more important thing to note, though, is that last piece where it alerts our team based on needs. So once we've done as much as we can at scale, that's where our really great team comes into play, and what I like to describe as our concierge sort of level of service. So we handle everything. We have our own team that conducts two-way SMS engagement. They make the phone calls if needed. But they also are communicating with the plans regularly. So that's really important too, because if something happens, if there's a really urgent need, you're not just notifying the plan, but there's also a person who speaks that language, who's able to connect with that member to make sure that when they do get to the resource that they need, that they're able to actually use it. So that's the touch part that I was talking about. We're really proud of our team of care coordinators. We've spent over a year, sort of putting together the right processes. Typically, our care coordinators go through at least 3 rounds of interviews before they even make it to our office in LA, where we sort of, meet as a team, and that drives the decisions and the next steps. On our exceptional team, it's comprised of 86%, of the team has immigrated to the U.S. from another country. 14% are first-generation Americans who are still really deeply rooted to their culture. Right now, we deliver services in over 22 languages, but we're always growing. I think this week we might have even added 2 more. Haven't confirmed that, but the diverse backgrounds that they come from, too, also bring a lot to the table. So these are people who've worked for the Peace Corps, for the Red Cross, doing emergency preparedness outreach. They've worked a lot with, the Mexican consulate, doing outreach there, too. So we're very picky and very choosy, but our care coordinators typically have a tenure of, this team as it stands right now has been around for over a year, and they have an average tenure of 11 months. So not only are we selective when we bring them in, but they actually stay. So we're able to build those relationships and build that trust because we have a great team. We put a lot of thought into who is responding to those exceptional messages and how we can deliver services in a way that really resonates. So let me walk you through what a message might look like for a couple of different members. The anatomy of a message is something we're very thoughtful about. So everything from the time when the message is sent to the target population, then we sort of layer on some campaign strategy, which typically has a lot to do with HEDIS measure or the outcome that we're hoping to achieve. And then, the purple circle is we talk a little bit more about resources that are available in that area. Like it was mentioned earlier, it's great to tell someone to walk more if they're diabetic and get some exercise, but not, as Andre mentioned, if they're going to be shot or if they're concerned about their safety. So we actually connect them with resources in their neighborhood that would help them find a safe place to walk. Those are all things that we consider when we craft a message that we send. So here's Fred. He is an immigrant. He's still working, even though he's a little bit on the older side. His message is more focused on education. He doesn't have a high school diploma, so we typically have to send him a couple of extra messages and explain things before we would expect him to take action. So we would like to emphasize why it's really important to him. This would be like an ED diversion campaign. So we'd let him know about an urgent care, why it's better to go there versus an ER, and then sort of dive in educationally after that. Alejandro, he's the sole provider for his family, so he really doesn't go to the doctor because he doesn't want to miss work. It's really important not just to him, but to his whole family and his livelihood. So, there are some key words that we would use based on different demographics and the research that we found. So because we've included that message, it really resonates and just reminds him how many people rely on him and that it's important for him to stay healthy for his family. We also include some surveying to find out if there's anything we can do to help him, to motivate him to make it to his appointment. So we're able to get not just culturally connected, but also to get some real-time feedback about what we can do to help him and, sort of meet the health outcomes we would expect. Then Ana is a second-generation Mexican-American. Even though she speaks Spanish, she still likes to receive her health communication in English. She's really proud to be Hispanic. She's really family-oriented, and so her message focuses on getting the appropriate care for her family. So as you can see, there's a lot we do. There's a lot of clients that we work with, and I personally manage some of these relationships. I'm happy to speak to any operational points there. We do have a lot of success, too. So we have 85% success rate with appointment reminders, 59% gaps in care address with a 7-to-1 ROI right now. And then we're most proud of our impressive outcomes for diverse populations. So recently, we were able to deliver messages to 91% of a homeless population that was not able to receive messages before. And in addition to that, with a LGBTQ clinic that we work with, we actually had great success with a trans male population for a cervical cancer screening campaign. So, we put our money where our mouth is. It's really great that, we have all these tools, but the outcomes are pretty impressive too. So let me hand it over to Kevin, and he can talk a little bit more about making it work for you.
Yeah, well, just very quickly, Kevin McCarthy, you say the founder, the operations person, and now the business development person. You have to hear from me. So it's in your packets. I know that another deck will be sent out post-meeting. You can find us in the room here. We can actually take your mobile numbers and send you a demo in terms of what the real-life experience is like for a member or a patient. We would encourage you to look at your organizations and maybe benefits and solutions you're trying to drive your members to, where you're trying to get that bridge to help get that trust and that engagement to bring them to things you're already investing in, as well as your providers. You might have specific providers that are reaching out and asking for help. We work closely with providers as well, many times on behalf of the plan that is trying to introduce more tools and solutions on behalf of them as well. So we are here all day, but thank you for your time. I know we're under a wrap, and we're going to Q&A now, I believe.